Why do different sickle cell genotypes handle fever differently? Have you ever wondered why people with sickle cell disease experience fever in different ways? Sickle cell disease includes various genotypes, such as HBSS, HBSC, and S-beta plus thalassemia. Each of these genotypes has unique characteristics that influence how the body reacts to fever and infections. Fever often signals an infection or inflammation, which can be particularly challenging for individuals with sickle cell disease. For those with the HBSS genotype, which is the most severe form, the breakdown of red blood cells is more pronounced. This means that during a fever, their hemoglobin levels can drop quickly, leading to a higher risk of complications. On the other hand, individuals with the HBSC genotype typically have milder anemia but face their own challenges. They may experience dehydration and potassium loss during fever, which can make their red blood cells more rigid. This rigidity can lead to sickling, especially during infections. Interestingly, some studies have shown that patients with HBSC can have a higher risk of severe outcomes during specific infections, such as dengue fever, compared to those with HBSS. S-beta plus thalassemia presents a mixed picture. The severity of symptoms can vary based on how much beta globin is produced. This variability means that responses to fever can differ widely among patients with this genotype. When a fever occurs, it increases the body's metabolic demands and can lead to dehydration. For HBSS patients, this can quickly worsen their anemia and trigger painful sickle cell crises. Meanwhile, HBSC patients, despite having less severe baseline anemia, should not be overlooked during febrile illnesses. All sickle cell disease genotypes share a common risk, functional asplenia, which means their spleens do not work effectively. This condition increases the risk of infections, but studies suggest that the risk of blood infections during fever does not significantly differ by genotype. This indicates that while infection risk is high for all, the way fever affects each genotype is more about red blood cell characteristics than immune differences. In managing fever, it is crucial to recognize these differences. Patients with HBSS often need aggressive hydration and careful monitoring for worsening anemia. Those with HBSC should also seek prompt medical attention during fevers, especially in areas where certain infections are common. Overall, understanding how different sickle cell genotypes handle fever can help in developing better strategies for infection prevention and fever management. Each individual's experience with sickle cell disease is unique, and consulting healthcare professionals is essential for tailored care.